Welcome back, everybody. Thanks for joining me on another episode. I think today is going to be an awesome episode for you to listen to. We're going to talk with a healthcare professional who you may not actually think of as being in the healthcare profession. We're going to learn how this profession is actually very useful and can have profound impact on patients, sometimes quite immediately. They work with other healthcare professionals such as orthopedic doctors, rehab doctors, physical therapists, and we're going to learn about what it's like to be a massage therapist. Yes, that's the career we're going to talk about, massage therapist. And the person that we're going to talk to is Mr. Whitney Lowe. And Mr. Whitney Lowe is actually an educator in health therapy. He used to be a clinician doing a lot of it intensely and heavily, but he's then transitioned into the educational aspect of educating massage therapists. And he's actually very involved in this profession. He's created a wonderful website educating massage therapists or someone considering being a massage therapist. There's a lot of valuable information in his website, but also he has a podcast, he has forums, and he's also been involved in a lot of the certification process and the licensing process of this profession. He's trying to elevate the standard of this profession, and he's been trying to do that for a number of years. So he has a real in-depth understanding and perspective that maybe other massage therapists don't have. We're also going to learn a little bit about misconceptions people have about massage therapists. Even I was educated that a lot of massage therapists don't like the words masseuse and masseur, and we'll learn a little bit why. And he'll also talk about how this is a profession that people can jump into with not as much time and commitment like you would need to for a nurse or a physician or even a physical therapist. But yet, being very early on in your career can have a immediate and strong impact for patients. So he's going to drop a lot of value bombs, value nuggets that I think you're going to really appreciate. And if you think you like this episode or even other episodes, I really encourage you to please check out my website. Give me a 5-star rating if you think it's worth it to whatever podcast directory you listen to. And if you have any comments that could be helpful, then send me an email through my website or just drop a few comments in whatever podcast directory that you listen to. That'd be very helpful. It'll help bring attention to this podcast and this episode to other listeners that might be looking for this information. So looking forward to your help there. Mr. Whitney Lowe, a massage therapist, actually all the way from Oregon. So thanks for joining me, Whitney.
Good to be with you. Thank you very much for the invitation.
So let's just dive right into it. What's a quick bio? Can you give us a quick bio of yourself?
Yeah, so I am a massage therapist and predominantly a massage therapy educator. Now I've been doing a lot of work in the teaching realm. Been a massage therapist since 1988, so I've been involved with the field quite a good bit. I got into this originally. I was studying psychology in graduate school and got interested in some of the mind-body connection, and that's how I sort of got involved with massage therapy. Went to massage therapy school, got trained in Atlanta, Georgia, went through a number of other training field or another bunch of training programs and things there in the massage world. Went back to graduate school one more time for a master's degree in sports medicine and biomechanics, and then interrupted that graduate degree to take another opportunity that I had in the massage world that I thought was going to be, I was unable to pass it up. It was just too good of an educational opportunity. So I've been sort of a perpetual student in and out of places for a long time. Then I moved out to Oregon in the mid-'90s, written a couple textbooks, and been involved with both seminars and training programs around the country and online education for a good number of years. So quite a number of different pieces of the pie that I've had my fingers in the massage therapy world.
And we're going to jump into a few questions here, real quick hit questions. Give us a real kind of taste, if you will, of your profession. So as a massage therapist, or as massage therapists, what do they do in healthcare exactly?
One of the most fascinating things about the world of massage therapy is there's so many diverse avenues for people to get into. It runs the gamut from people doing palliative care with geriatric patients, for example, or working in hospitals with cancer patients, to the very common group of people that are working with all sorts of musculoskeletal pain and injury problems. Maybe they're working in chiropractors' offices or physical therapy offices or in conjunction with other health professionals, or many of them working independently in their own clinics or other types of places. So there's a lot of different avenues. There's massage therapists working and traveling with sports teams, with dance troupes. There's just a tremendous number of variety of situations that massage therapists may find themselves in.
Wow, a lot of opportunities there. We're going to dive into that a little bit later on.
Yeah.
What are the usual steps to achieve the professional certification of a massage therapist?
So the big thing is that massage therapy training requirements vary significantly. And I'll speak mostly to the United States because that's what I'm familiar with, but it also differs quite a good bit around the world. But here in the United States, training varies by state. So there are credentials that are statewide. We still have a few states that don't have licensure for massage therapists. I think we're about at 4 or 5 of them right now that still don't have licensure for massage therapists. But most of the states have training programs that run somewhere between about 500 to 600 hours up until maybe 1,000 hours or so on some of the other programs. In a couple different states have requirements that are that high. So that's about the average, and those are clock hours of training. So that kind of divides up into various different ways by months or how the programs are set up.
And what is the best part of your career?
I would have to say, without qualification, the best part of this profession, this career, is the capability to walk into a room with somebody and interact with them and change their life, basically, by nothing more than what you do with your hands and your interaction with them. I've had so many instances where people were just taken out of, very significant long-term pain problems, or just felt like, what you did with connecting with them and working with them with hands-on care is something that people are craving tremendously, and it's so rewarding to be able to be a part of that process with people.
That's awesome. Is there a least favorite part of your career?
Yeah, I'd say the least favorite part perhaps is the physical demands. Massage therapy is a very physically demanding thing, and it can get lonely for people as well. But you are sometimes seeing 4 or 5 people a day, maybe, for an average practitioner. Some people will see more if they're working on shorter duration sessions, but you're just in a room with those individuals by yourself, and oftentimes quite isolated from people. So that can get to be hard sometimes after a while.
Got it. Yeah. Well, that's great. I love that quick hit questions. That's very helpful. I'd just dive into some meatier questions, if you will, some of which you kind of referred to. The credentialing aspect of being a physical therapist. What is there's both licensing and credentialing.
Yeah.
And it varies by state. So if someone is interested in this career, what do they have to do to learn about that? Do they just look up, say, I'm in Georgia, look up how to become a massage therapist? Is there a credentialing body that helps steer people in the right direction to make sure they get the right credentials and licensing?
Yeah, so right now I would say that we're kind of coming out of a Wild West sort of situation in massage therapy education in our country. Just to give you some perspective about this, when I went to school for massage therapy in the late 80s, there was somewhere, I think, around the neighborhood of 50, maybe 40, 50 massage therapy schools in the country.
Okay.
By 2005, there were over 1,500 massage therapy schools in the country. That is a huge learning curve. I mean, population curve, or number of training program curve. Now, the big part of that is we didn't have enough qualified faculty to staff all of those massage therapy schools. So unfortunately, we see a lot of decline in the quality of what's happening in massage therapy training because of the number of training programs that are out there. So finding a good training program is really important. And each state has a state that has licensure for massage therapists has a licensing board, but that's not really going to be the best place to identify where to get good training. The best way is to really ask around for people who are already in the profession. Where did you do your schooling? What was your experience of that schooling like? Ask around on social media. There's a number of massage therapy forums. Ask what people felt like in terms of the quality of training of their different programs. You'll get a good sense of the very wide variety that is out there.
Wow. So because as we talked about before we started recording, massage therapists are masseuse are everywhere. I mean, they're airports, they're in shopping centers. They could have their own private office, if you will. They're affiliated with medical practices, and the question is, how do you separate? If you want to enter this field, how do you separate yourself from that? These other massage therapists that we're not even sure if they are massage therapists.
Yeah, so this is a big challenge that we've had throughout our profession, and when I got into this in the late '80s, and this is still currently a problem, is changing the public's perception about what massage is about, from really sort of detrimental associations with sex workers over the decades prior to that, and lingering perceptions with terms like massage parlor and things like that don't really give a sense of working in a healthcare arena. And even the term masseuse is really considered sort of a denigrating term. It has some other historical context, but that's not something that if you're talking to somebody who does massage therapy for a career, they probably don't want to be referred to as a masseuse. The other thing people don't realize is it's a gender-specific term. So I will never be a masseuse. I would have been a masseur in the earlier way in which those terms were used. But again, we tend to prefer use of that term. But here's the other dilemma, is that massage therapy as a profession is really sort of a split personality. We have the one aspect of this profession that focuses more on what we like to refer to as maybe a wellness model or a personal well-being model. And this is massage therapy performed at spas, cruise ships, resorts,
hotels,
even private practice I want to go to really just feel good. I just want to relax and de-stress and feel good. Then there is massage therapy that is done in more of a medical context to address what we say maybe compromised health conditions. And this is, massage for cancer patients, massage in a hospice, massage for sports injuries, dealing with athletic teams, or dealing with physical therapy clinics or chiropractic patients. So the distinction right now, this is a big problem. We don't really have a good way to make a strong distinction because there is no national credential that distinguishes those two really very divergent training tracks. And that's actually one of the things that we're working on a great deal, is to try to see if we can find some way to do that better.
Got it. That being said, if someone wants to be a massage therapist, do they need a high school degree?
Generally, most schools will require a high school diploma as a basic entry-level requirement. High school diploma or GED or something like that is almost always a requirement. Yeah.
So you don't even need to go to college or community college at all?
You don't need to go to college. It's considered more like a trade or vocational school. So, which is great in terms of ease of entry into the profession, meaning you can get into the profession with a relatively low barrier or low bar.
Yeah.
But the flip side of that is when you come out, you have the capability to basically see anybody that you want to. They can basically make an appointment walking off the street and see you. So, I like to call this to people's attention is in terms of thinking about this, is that, when we say you can enter school with just a GED or a diploma, you can have an 18 or 19-year-old kid being a direct access healthcare provider with very, in my opinion, inadequate training to be in that role. And so that's
right.
In our profession, continuing professional education or continuing education coursework becomes a crucial aspect of the professional development of those people who are going to work in a more medical or healthcare oriented environment.